I personally would not take it myself.
Okay.
Yeah.
So in terms of the components and the effectiveness we talk about, right? So yes, I take the example of COVID, right? So we had this new phenomenon, COVID. We didn't know about it. So yes, the vaccine was new. So which approach was better? Yes, definitely we were kind of proactive, jumped and took the vaccine. But was it like better to kind of wait and watch a little bit and see what the outcomes were in terms of like, is it actually helping? Is it not helping? And then take the vaccine? Or maybe just do, due diligence, research, everything is okay, then it's good to go.
So the concept of tawakkul again, putting your trust in Allah subhanahu wa ta'ala. I spoke to a physician before going for the vaccine, and he said, Sheikh, let me tell you this. COVID is very ugly and very nasty virus. It can destroy any organ in no time. All right. So it's all about the probabilities, right?
All right.
What the risk, yeah. So if you get the virus right now, if you wait for until you take the vaccine and you get the virus, well, you're likely to die. Versus taking the vaccine. If you take the vaccine, then
maybe side effects here and there. Yeah.
But it's not gonna lead to, for the most cases, it's not gonna lead to death. All
Exactly.
right. So here the tawakkul here, okay, right? The concept of tawakkul again, Bismillah, tawakkaltu ala Allah. Nothing is going to happen to us except with the permission of Allah subhanahu wa ta'ala.
Exactly.
Therefore we tell people, no, go for it. Go for it. And from Islam, as a Muslim scholar, I need to listen to you guys. I always do this, right? I don't come up with like a medical fatwa from my own. Allah subhanahu wa ta'ala tells us in Quran, فَاسْأَلُوا أَهْلَ الذِّكْرِ إِن كُنتُمْ لَا تَعْلَمُونَ. So ask the people of knowledge if you do not know. So the people of knowledge in that field, they're the doctors, the physicians. So I said to people, whatever the doctors say, we follow them here, right? That's an Islamic concept.
Exactly.
Not follow the people of the experts.
Expert in that particular field.
Definitely. Right? But that's.
And I think there's a whole concept of this show is right to have that or bridging the gap between healthcare and spirituality, right? So when two experts come on a similar page, we try to bridge the gap, share the knowledge, and just to make sure that our people or the population in general can utilize the best of both worlds and have good outcomes.
Yeah. Also, there was one incident. There was what's the disease? I don't remember, but there was something like a virus during the time of Umar ibn Khattab. I don't know if you know the name of it. But Umar ibn Khattab was the first one to actually implement quarantine.
Mm-hmm.
The concept of quarantine, right, was introduced during the Umar ibn Khattab. He said no one is allowed to leave the town, the city, nobody's allowed to come in, right?
If I'm not mistaken, it's plague.
It's a plague.
The bubonic plague.
Correct. Yeah.
Bubonic plague.
So Umar ibn Khattab, the Khalifa of the Muslimin, he also introduced the concept.
Which I think is such a beautiful example of Islam because I didn't find many Muslims protesting the quarantine and, listening to the experts versus maybe some other individuals.
Yes.
And even just your example too, we have to fast during Ramadan, it's prescribed for all of us, but yet we still have exceptions,
Correct.
right?
Right.
It's based off your health. If your doctor thinks it's, maybe not the best case scenario, all these things. So it's just it attests to how beautiful our religion is, and it's, understands there are other processes in life that we have to pay attention to.
Definitely. That's very beautifully said. Dr. J, let's say that if I come to your office as a patient, right? So what should I expect? Like, definitely, I'm sure you're going to check my heart rate, blood pressure. So what blood tests you're going to offer me as a patient, or what screening exams, like based on age?
So it all depends on age. So, we have categories for women, categories for men. We have age, in your 30s, 40s, like I said earlier on, it's a lot more preventative talk. Later on, it's more blood work, starting with family history, cholesterol, diabetes. If you're 45, for sure, you should be getting cholesterol panel, your kidney, liver, enzymes checked. You are to see if you're have anemia or even prostate, depending on the age and your family history. So, we screen for all these things, and there are some things that people come in with a list of their own, and that is a good discussion with the physician. And honestly, a lot of it is due to insurance barriers too. So I've had, for example, my husband who's in his 30s and had his cholesterol checked, and insurance doesn't want to pay for it. Meanwhile, every man in his family has almost had a heart attack, and he has known history of cholesterol, and we're trying to manage it and all of those things. So sometimes it's just, yes, there are guidelines, and then we have to talk to the patient like, well, the guidelines don't say that we should get this cholesterol on you, but looking at your history and all these things, maybe we should consider it. And then teaching the patient that insurance may not always agree with the physician. So there is a disconnect between what gets paid and what the physician and the patient want to do.
Right. And I think, as you said, it's also more customized based on the patient's health, age, and what they actually need.
Exactly.
And lately I'm seeing the testosterone, the calcium, the thyroid, they are getting more popular.
They're getting more popular because we're also seeing a lot more of it in the population. So whether that's our food, lifestyle change, things like that, we are screening for, thyroid. Testosterone is a bit of a controversial topic because if done incorrectly, people will get overdiagnosed or misdiagnosed. I've seen, physicians that are not trained to order a random testosterone just because a patient is tired, completely disregarding they may have sleep apnea, obesity, or, other diseases, kidney diseases that all play a role in how testosterone is processed and what levels you get. So it is really important to, speak to your doctor, but also for the doctors to not be always intimidated just because I have someone who is maybe obese or has sleep apnea or other conditions, diabetes, and who's just like, oh, I'm tired, I need my testosterone checked. Well, let's look at you as a whole person. Maybe it isn't. And also drawing it in the middle of the day is a completely wrong way to order testosterone, We have symptoms we go by, and then we have things that could also cause those symptoms. Like if you're tired and you have, for example, impotency problems, it could be because you're not sleeping, you're overweight, you have no energy based off of those things. But I think the idea in a fast-paced world is, well, if you get this blood and that's positive, then I can get an injection and I will feel great, right? Versus what we talked about, changing that lifestyle and doing the hard part of undoing things that you've done in the past. Now, that's long-term work, and that is hard for, the new generation these days.
We are in a fast world. We need quick fix, quick pill, everything in a matter of click. So definitely, instead of jumping on one conclusion or presumed conclusion, better to have a holistic approach, kind of like ruling out like sleep apnea by doing a sleep study, if those are the symptoms, checking your weight or losing weight, checking family history, thyroid issues.
And doctors don't mind, I would love to know the exact answer and here's your medicine, now you feel good, right? But we want to make sure we're doing the right thing. We want to make sure, that we're not setting you up for failure, because testosterone injections have lots of side effects, There are, bad outcomes that you can have if, treated or diagnosed inappropriately. And then the other things I think we were kind of mentioning in some of the questions were, vitamin D, for example.
Exactly, vitamin D.
Yeah, so, and that's been a controversial topic. And unfortunately, I think people come to the doctor expecting answers that are concrete, but it is a moving piece. And that is because new research, poor research in the past, all these things take into effect of what we say. So, but, the good news is we are getting better tests, better research. And, just recently I read an article that in patients with certain digestive disease tract cancers, they actually do benefit from high dose of vitamin D. I just worry about the person taking things without consulting a physician, because there are bad side effects to, taking too much of vitamin D. It can be toxic. So just finding that perfect patient and really tailoring medicine to the individual instead of a blanket statement for everyone.
Exactly. And kind of like, I once again like to emphasize the role of an expert, right? So health problem for a physician a spiritual problem or any psychological issues for Islamic scholar. So to go to the right resource and get the opinions from them rather than kind of presumptions, Dr. Google, Dr. ChatGPT, other stuff. And sometimes these tests are being kind of linked directly or indirectly to depression, which is kind of like an endemic situation right now in these times, right? So are they really playing any role in depression, anxiety? Because let's say that, oh, I'm low in vitamin D. Probably that's the reason I'm depressed. So what do you think about it?
Yeah, so if someone is low in vitamin D, and if there's no harm with supplementing, we are okay with with supplementing and then watching and monitoring.
Sure.
But that's where the follow-up comes in, right? So in order to really build that trust and that relationship with that patient and saying like, okay, your idea was that maybe it's my vitamin D, right? It's been a month, your vitamin D is looking better, all this stuff. Is your anxiety and depression better? Let's look at what your screening says and how you feel and what you say, right? If not, say, well, maybe it wasn't that. Let's talk about other things. Let's explore your lifestyle. So it's really meeting the patient halfway and gaining their trust, because once somebody thinks that, their reason is this, unless you work with them and help them figure out whether that it is or isn't, you're not really going to get anywhere by putting your idea and throwing your, presumptions at them. So, again, each individual person, working with them, if their vitamin D is low, let's supplement it. Let's see you back again. Do you feel better, or is it something else?
Follow-up is definitely very important
sure.
after you start or do any treatment. Sheikh, what we notice in healthcare is that physical health and mental health sometimes goes hand in hand, right? So if a person is in good physical health, again, there are exceptions to the rule. If somebody is in good physical health, they are most likely that they might be mentally strong too. But if somebody is going through depression, anxiety, and psychological or social issues, their physical health deteriorates too over a period of time, if not already. So as a holistic approach, or as from the spiritual perspective, how can we help people kind of build like a strong mental immunity, I would say, right? So if you are having a strong immune system, you're less likely to catch a disease, right? So how can we make people like mentally strong? What recommendations you have? That will help both mentally as well as physically.
So my doctor said, he talked to me, he said, Sheikh, a lot of times I check people, I examine them, and they have nothing, right? And I know that it's all about their mental health. It's really affecting their bodies.
Yeah.
So a lot of times people come to the masjid and talk to me, and they say like, we're not feeling well. And the first thing that I like to rule out is like, did you visit the doctor first? They said, yeah. They said there's nothing, right? So my approach with them is always focus on the soul. So Allah created us from body and soul. All right. So a lot of times, like your body, alhamdulillah, taking care of it. Even you might be, you work out, you eat healthy and all of these things, and you travel, you have fun, but still there's something out there. I tell them that we take care of our bodies, that we forget our souls sometimes, right? So that's where spirituality and the deen and the iman of Allah subhanahu wa ta'ala comes, right? Because Allah created us and He put this soul within us, right? That's the spirit of Allah subhanahu wa ta'ala, the soul. And there is one source of energy, the spiritual energy, it comes only from Allah subhanahu wa ta'ala, right? You need to get this through Salah. Salah is extremely important. If a patient come to you and they're practicing, even if they're not practicing, talk to them about this. Have you tried to go to the masjid to pray? They get a lot better when they talk. Mm-hmm. And then, of course, we talk to them about, the concept of faith, the concept of tests and trials, the concept of sabr, patience is very important. Right?
Right.
So when you focus on this aspect as well, and people tend to feel better. Number one, because they had someone who actually listened to them, someone to remind them of the Prophet ﷺ, remind them of the reward. right? The Prophet ﷺ said, like, nothing happens or afflicted you except that your reward, Allah will be rewarding you for this. Your sins are going to be wiped out completely. That the Prophet ﷺ tells us, and that's one of the hadiths that people like, you know, they feel better when they hear from me. The Prophet ﷺ tells us that the people who were healthy in dunya, they were fine, they were not like as, you know, have not been as tested as much. On the day of judgment, when they see the reward of those who have been tested severely in dunya, they would wish to come back to this life so they can be tested more. You know what I'm trying to say? So
Yeah.
it's you hear this like subhanAllah.
I think it's very important, you know, and most of the times we feel there is lacking something, you know, some piece in the puzzle is missing.
Yeah.
And we also see in healthcare that people who have strong faith, that believe in God, I mean, regardless of what faith you follow, they have better outcomes, even if they are going through a certain disease or a problem, compared to people who don't have a faith, right?
Right.
So I think
Or a community.
Yeah, as a community support, right? As a community support.
Yeah.
So I think, yes, definitely as professionals, we can be a little biased that, hey, I'm a doctor, so I'm just going to focus only on the physical side, the medical side of it. But again, regardless what our faith is, we should always keep our ears open and a door of possibility that, yes, if that is helping you, then why not, right?
Yeah. Every Muslim is a messenger. Every Muslim is a da'iyah. You have a role to play. It's not just about the imam who gives the khutbah. Allah has blessed you with the knowledge of medicine, right? That's wonderful, right? So in your job place, in your workspace, you have people coming to you, and these people, they're vulnerable, right? They will trust you. When I go to the doctor, I trust what he says to me, right?
Yeah.
When you tell them, hey, how is your spirituality? They're not going to say, oh, you Sheikh, why are you asking me this question? Like, go talk to Imam, you know? A lot of things that also I want to point out, is very important. There is concept of sihr and concept of, evil eye. It's an Islamic concept also. It's mentioned in the Quran that there's something called evil eye and nazar and envy and all of these things. So a lot of times you check somebody and perfectly fine. I visit this sister, she passed away, may Allah show her the mercy. She was in the hospital for 3 months after she came back from, I think from Africa, somewhere in Africa. And I visited her in the hospital. I went to make dua. The family requested me to go make dua for her. And honestly, I asked the family, like, what's going on? They said, medical speaking, there is nothing. 3 months, blood tests. I don't know if even that's possible or not. They said that's in her case. They don't know. They said, we don't know. Right? Maybe it's a virus she brought from somewhere. We don't know. There is nothing medically. All right?
No, I'm sure there are limitations to sciences too. We do acknowledge that.
So that's also tell people about the Ruqya Shar'iyya, reciting Surah Al-Baqarah, reciting Al-Fatiha. The Quran is shifa. Actually, shifa is for physical. In the book that I highly recommend that you as also doctors read it, The Cure and the Disease by Ibn al-Qayyim al-Jawziyah, he also speaks about that. He said the cure for Quran is cure for the physical illness as well. SubhanAllah, and he has a lot of examples that we're reciting Surah Al-Fatiha with certain intentions. Maybe you've heard this, and you hear this from people like even cancer patients, like there was no hope, and all of a sudden, SubhanAllah, with the help of Allah subhanahu wa ta'ala, it happened, right? Another powerful thing that we always tell people is to strengthen their spirituality and their iman of Allah subhanahu wa ta'ala is dua. Dua is such a powerful, weapon. Really, it is, to ask Allah subhanahu wa ta'ala to have this private conversation. There's something called the munajah, to talk to Allah subhanahu wa ta'ala one-on-one. Ayyub alayhi salam, right? He was ill for 40 years, and he said, "Inni massani ad-durr wa anta arhamur rahimin." Ya Allah, you see what's happening to me, and you are the most merciful.
MashaAllah, very beautiful.
This reminds me of some of my patients who are just so content with life. They have like 20 diagnoses, some of them being, cancer, and they walk in and they're just like happy, full of spirit, walking without problem. You would never assume that this person is carrying this disease burden,
Wow.
But that content with life, the endorphins you get, not just from exercise, but just from feeling good, they play such an important role in how you carry yourself and how long you live. You know, how many times have we heard like, you know, hospice patients, oh, they have 6 months and this person's 3 years on, and you're like, okay, you've been
the doctor
dismissed.
dies before them.
Exactly.
Yeah, you know, talk about the dua. There was one scholar who we were talking about the child loss before we started the podcast. So, subhanallah, talking about the dua. There was one of the scholars who actually burying his daughter. She was also a cancer patient. It was somewhere in. It was, I think, in Syria or Jordan, something.
Okay.
So he was giving a speech. I don't know how actually he had the courage to speak and still preach people while he's burying his own daughter, right? And he's very popular. He had like a couple million followers on social media, and he said to people, "Listen, I know a lot of you now, think that where's the dua? Millions of people have been making dua. Where's the dua?" I said, "I have seen the results of the dua in my daughter every single day. The amount of sabr, the patience that she had, the peace that she had. That's your dua. The dua doesn't mean that Allah will keep her alive. Mm-hmm. She might eventually die." But the effect and the impact of the dua will still be there. Look at me talking to you right now. You know why I'm talking? I'm holding like very strong because of your dua. So the dua will work. So it's something we need to remind people, to remind people to keep this connection with Allah subhanahu wa ta'ala. It's very
definitely.
important.
I think those words will be very encouraging to our listeners who are listening, and definitely they can make those changes, have positive impact in life. And eventually the goal is, to live better, live stronger, both physically and spiritually.
See, in Jannah, may Allah give us Jannah, inshallah. So it's very important. Allah created dunya, and that's what I say to people. This dunya is not meant to be a Jannah. People want it to be Jannah. You want to always be healthy. You want to be, you're not going to be tested. If you don't want to be tested, if you want to be healthy, if you have, your wife is good, your kids are good, and everything is good, that's Jannah. So, and Allah said, I'm not going to create this to be Jannah. He said, لَقَدْ خَلَقْنَا الْإِنسَانَ فِي كَبَدٍ. That's part of that's part of the game. You know, like we will create you sometimes ups and downs. We're happy in your life. It's part of the test. But as Dr. J said, the reward that eventually, what is the reward? That the very first thing that people of Jannah will be, the people of paradise will hear is like, أَنَّ لَكُمْ أَلَّا تَصِحُّوا فَلَا تَهْرَمُوا أَبَدًا. The first thing that Allah subhanahu wa ta'ala will say to them, that you will be alive and you will never die again. The second one, that you will always be healthy and no more struggle. Mm-hmm. That's it. So that's the moment where everyone is, expecting.
Exactly.
So eventually there is an end to your suffering and your pain. Because some people, they lose hope, right? Yeah. Especially the long-term patient, they lose hope.
Yeah, so definitely. And coming back to you, Dr. J, is one, I would say, a challenge or one block that people don't reach out or take care of themselves or or go to a doctor is, especially in America or Western world, is either they don't have insurance, or if they do have insurance, they have high deductible, like a few $1,000s to pay. And definitely, finances play an important role in everybody's life. So how do we deal with those patients in the scenario? Let's say that I don't have an insurance, but still I have the will to see a doctor and at least make sure that I'm doing okay. So is there like any alternatives? What do you recommend?
So I'll tell you this. This is one of the biggest barriers to building a physician-patient relationship, and one of the reasons why a lot of doctors are not trusted these days, right? I think the insurance world is great. There's a place for it, but it's also created a lot of barriers for trust and mistrust. It's created a lot of mistrust between the patients and thinking that physicians are out here to make money. They're not with our interests. They see me for 10 minutes. It's in and out. They're telling me to come back in 2 weeks. Like, I've heard it all. Okay, I've worked in the corporate medicine world with insurance, and now I'm outside of it. So doctors are not happy. No doctor wants to spend spend their day seeing 30 patients, charting for the next 3 hours to make sure their clinic is paid. And they're usually not even paid, sometimes not even 50% of the actual cost. So then administration does their thing to, up the amount of patients you see. And now I can't build that relationship with you. Now I can't really get to the bottom of things. Are you having any spiritual issues or anxiety, depression stemming from something, right?
Right.
So, I have an example. We just, my baby had a hip x-ray and the bill came back. It was over $500 for one single view. And now I know that's not going to the radiologist. And I know the cash pay costs, which would have been $50 to $75. But, people are adamant about using their insurance because I pay $500 to $600 a month, for the family. So
Exactly.
Why this cost? Where is it going? You're not seeing any results of what you're paying. So insurance is really making it hard for us to build a healthy society in many ways, unless you have a limited amount of money, right? There are alternatives for people who do have that high deductible or no insurance. There's something called direct primary care, and direct primary care was created by physicians who saw this problem and this barrier. So you can have, it's kind of like a monthly fee, and I don't call it concierge because that's usually thousands of dollars, and they take insurance and all these things. So with direct primary care, what happens is the price can range from $50 to $100 depending where you're at.
That's per month, right?
That's per month. And usually, and sometimes it's just $70. That's kind of like the average per person. So with that $70, the patient actually has unlimited visits. So if I have to see you back in 2 weeks, you're not paying anything else. If you come 4 times a month, you're not paying anything else. That $70 subscription pretty much covers that relationship and the physician fee. So it's kind of mind-blowing that, wait, for $700 to $900 a year, that's almost my one x-ray, but I can have unlimited visits with my physician,
Yeah, definitely. Because if somebody doesn't have insurance, right? And if I'm suffering, if I'm sick, I have to think 10 times because, as you said, one x-ray if it's costing $500, it's a big amount for an average family, especially in this times that we are living in. But you're saying that an access to healthcare is much cheaper than we think of, right? Anywhere between $70 to $100 or even $150 a month. That's not a big amount. You can still see a doctor, get checked up, and get recommendations.
Yes.
And they have no limits in terms of how many number of times they see what they need.
And this is particularly to primary care because we know we can take care of most of the problems in primary care.
Sure.
And obviously specialists, it's a different world, things like that. And, people get worried about what about imaging? Like I said, when I looked into it, that x-ray was actually cash price $50 to $75. Now, I don't know what happened in between with insurance and the billing and the deductible that made it $500, but MRIs, cash pay, are cheaper than that. You can get that for $350 versus a one x-ray. Labs, you can get a cholesterol panel who's, my husband got his bill using his insurance for $100. He could have come to me for $7. I could have gotten him that cholesterol panel for $7.
And definitely in the link below the screen will provide the resources where they can get cheaper labs if they don't have insurance, and definitely we'll share your contact, your website too, if somebody who doesn't have insurance and they need to see a physician.
And one wonderful thing about direct primary care, not only is it cheap and affordable, especially for patients without insurance, but they can actually text and call their doctor, and we call it just like having a doctor friend, right? And we usually try to get them in same day or next day. And this isn't just my practice, this is all over the country. So there is a website you can go to, and you can find direct primary care all over the country. These are physicians who are leaving this world and saying, this is bad care. I can't spend time with my patient. I can't follow up. I can't get them, cost-effective care. And so, there's Muslims. I know tons of Muslims who are physicians who are doing direct primary care that you can find just in our area, in Irving and North Richards. Is it Richards Hill? I'm not on this side. Richardson. So, this is literally, physicians standing up to corporate medicine and saying, I can be a better physician. I can spend an hour with you and I can do all this preventative care and tell you what you need to know so that 20, 30 years down the road, you're not in the ICU or in your ER.
Definitely. That's very important. And I think what's more important here is restoring the sacred patient-physician relationship, right? And the whole goal is to have better outcomes at a very affordable and cheaper pricing. So definitely, again, insurance has its role if somebody has it, but again, people who does not have and they need resources, definitely direct primary care is the way to go. And what I'm hearing from the conversation is like, if we emphasize more on the preventative side of it, primary care, getting things detected early or get screened early, you might not end up with a specialist when the problems are actually later stage.
Yeah.
So try to focus on the foundation, try to focus on your basics, especially connecting with the direct primary care, and then go from there.
And also, in the almost every masjid has a free clinic.
Yes.
I'm not sure if brothers and sisters know this or not. In our masjid, they have a free clinic because of we're expanding, alhamdulillah. So the volunteer, mashallah, physicians, they use my office right now. So you open, literally, my office, half of it, has like Islamic books. And then like one shelf has like medical stuff. So people, when they look, I know when they come to the office and they don't ask, but what is this? I was like, tell it here.
But it's all connected.
All connected, right? We have the spiritual cure, inshallah, and we have the physical cure, inshallah, as well.
Inshallah.
So every masjid, Irving, Richardson, Epic, West Plano, every masjid has a clinic. Some masjid actually have also dentists. Volunteers.
Exactly.
So alhamdulillah, we have some resources that we can work with.
And thank you for reminding. And this is like another resource for the community that every local masjid, I mean, I'm not saying every, but at least almost majority of
big
them,
ones,
they have medical clinics on the weekends, dental clinics, and some are also coming up with the psychiatric clinics too.
Yes, correct.
So that's another resource. But again, there is only so much they can accommodate.
Of course.
So in that scenario, if they need to see a primary care physician sooner, they can definitely utilize direct primary care. But I think, again, starting from their local masjids is also a great resource.
Very important. You need a community.
Yes.
Yes, as a community. I think this is probably the best way to give back to the community, right? So helping the needy, it gives, I think it's more helping ourselves than helping somebody else, right?
Yeah.
So when you help out,
When you went to Bangladesh and you saw firsthand, right? It definitely changed your perspective.
It does. It reinforces what I've learned in a different form. And it's not a me against them. It's all of us together. We are an ummah. So, people, when they're 4 years old and they want to be a doctor, they're not thinking, oh, their salary in this, specialty is this and that. They're thinking, I want to help people, and we can all get back to the core of that.
Yeah.
Yes, and I think that's one of the biggest reasons, like people who have empathy, who have compassion, and who wants to go into medical field, they are better doctors compared to people who lack empathy and compassion. Sheikh, I definitely thank both of you for taking time out and giving us such a wonderful advice. It's an eye-opening for me, a lot of learning for me, and I hope our viewers enjoy and they take home something positive. Any last golden words for us?
Yeah, take care of yourselves, take care of your health. Doesn't matter. I always say to people, as long as you're taking care of your health, doesn't matter what happens to you in this world, you'll be fine. You lose your job, you lose your money, you'll be fine as long as you're healthy, because you can always make it again, right? Stay connected to the masjid, stay connected to the community, stay connected to Allah subhanahu wa ta'ala. Doesn't matter how much of fun you think you have in this dunya, unless you feed your spiritual needs and your soul, you're never gonna be happy.
Yeah, thank you so much. That's very helpful. Reminder for everybody. Dr. J, anything from you?
Yes, pay attention to your body. You live in it. You know what is good for you, what isn't. Get to know your body so that when you see something that's different, get a second opinion. And most importantly, if you don't feel a connection or, you don't feel like that doctor is there for you, find one that you feel listens to you. That, medicine, 90% of it is listening to the patient. And if you can't do that, you can't be, a great primary care physician. So find one that's going to be your advocate.
Definitely. Thank you so much for your time.
Thank you.
Thank you. Thank you for watching Doctor's Couch. I hope you like the show. We try to bring more and more useful information for you. Please don't forget to like, share, and subscribe.